We are live on the E360 network. Let's have some fun today, guys. Wow. So got to play with some technology today, which was a lot of fun, and getting to play with some different things. And I almost was late to the show because I was having so much fun learning some new things. So I hope you don't mind the intro. Had some fun with that. Did that about 30 seconds before we started. So anyway, I am so pumped today. And listen, those of you who watch the show, you guys know that I'm a follower of Christ. I'm a kingdom-minded man. I'm all about, helping people in recovery. I had my own issues with addiction, but at the same time, I have never, ever hid that, my belief in the cannabis plant. Look, it's not for everybody. I'm not here to tell you that it's for everyone. I'm not here to push anything on anyone. But it does have a purpose in this world, and everything God created is good. Sometimes man gets his hands on things and starts messing it up for everybody else. But the fact is, cannabis is medicine. And if used properly, it can be something. It can be quite the healing plant. Again, I believe cannabis is a gift from God. I also believe that about mushrooms. And the science and the research is there. And frankly, if you compare it to a lot of the other medications, and I've shared my story over and over again about how I was on 9 different medications, everything from pain management to sleeping pills to HIV meds to mental health medication. And the fact is this, I was able to get off of all of it by using cannabis. So look, this is not a place for judgment. I mean, we talk about some pretty heavy subjects on here, and but at the same time, I'm not going to put up a front and act like, even though I'm a Christian and everything else, that I don't believe in cannabis, because I do. And a week ago, for I Love 420, an event for iHeartRadio, I had the opportunity of hosting the event and interviewing some amazing physicians. But there was one that I was just really blown away by, not only his knowledge, but his passion for the industry, his passion for fighting on behalf of patients to help them get their medicine, because he has seen it in action, not only doing research and studies. The man is known all over the world for his expertise in the cannabis plant. So it is an absolute honor for me to introduce to the world, ladies and gentlemen, Dr. Joseph Rosado. What's up, brother? How are you?
Oh, man, near perfect.
Me? This is about you.
No, I said near perfect.
Oh, I thought you said I was perfect. They're like, I don't need that.
No, near perfect. I learned that when I was in chiropractic school. The president of the college, Sid Williams, may he rest in peace, would always say, when you would ask him, Dr. Sid, how are you? He's like, near perfect. I'm like, near perfect? Why? He's like, because when you're perfect, you begin to rot.
I actually have never heard that before. Wow.
So it stuck. So when people say, how are you? I'm near perfect.
You know what? From now, I'm going to steal that and use that from now on. Really quick, want to say hello to the audience. Jessica, good to see you. Patrick, your lashes are short and thin. Shren, good to see you. Always welcome here. Diana, great to be here. Or Dina, great to be here. So happy you're here. This is going to be a lot of fun. So, Doctor, again, it's great to see you again. But for the audience that's not familiar with you, tell them just a quick background about how you fell into, cannabis research and really taking the fight head on, when a lot of people are saying, cannabis is a taboo plant in the medical community, and it's starting to change, but it's because of people like you.
Well, thank you. But not only in the medical industry, but also in the world at large, because government, religion, and medicine have brainwashed society into believing that this is the devil's weed, and that's the furthest thing from the truth. But I'll take you back. I'll make it as quick as possible. Back in when I was in medical school, really, medical school was my 6th career, which you saw in my short bio.
That is the longest bio I've ever seen. But there's a lot of accomplishments there. There's a lot of meat. So it wasn't like you were fluffing yourself up.
No, yeah, I mean, that's what my marketing person says. There's a lot of content. We can't cut anything because then it would take away from who you are.
Yeah.
But while in medical school in pharmacology class, we briefly touched upon the endocannabinoid system. And I did a talk yesterday, and there were group of young ladies there, and I asked them. I said, if I were to check your blood or do a spinal lumbar puncture on you, would I find cannabinoids? Would I find cannabis in your system? And I mean, the majority of them were absolutely not. No way. Maybe tramadol because that's all I take, but you would never find any cannabis in my system. And so I quickly educated them on the endocannabinoid system, and they were like, "What? No way!" So, but we
There's a
briefly,
lot of people that don't know what that is, doctor. So before you go into that, I'm sorry to interrupt you,
yeah,
but do you mind explaining the endocannabinoid system, please?
no, not at all. The endocannabinoid system, which is what I learned I touched on it in medical school, and then over the years I've expanded on it. Um, we have receptors in our body where cannabis works upon. Therefore, we have an endocannabinoid system, endo meaning within, cannabinoid system. But the beauty of this endocannabinoid system, aside from having receptors, is that we produce our own cannabinoids. So any type of stress, whether it's good stress or bad stress, will stimulate or will trigger an action potential and will cause the body to produce these endocannabinoids. The first endocannabinoid that was discovered in 1992 and named by the gentleman that wrote the foreword to my book, Professor Lumir Hanush. And he named it after the Sanskrit word ananda, which means bliss. Therefore, the first endocannabinoid that was named is called anandamide.
Wow.
From the Sanskrit word, which means bliss, gives that sensation of feeling blissful, which is what cannabis does. Therefore, by adding or creating, finding this, it's really beneficial because now we understand that we produce this in our body. However, as we age, the levels of production decrease. Also, the amount of stress that we are under causes greater usage of this or of these structures. Thus far, 5 have been discovered and named. But in this era of the coronavirus, where people are losing their jobs or on furlough, or for example, the state of Florida was opened yesterday officially to start on Monday, and they allowed for restaurants to be opened, but they can only open at 25% capacity. You can't maintain a restaurant or a business with 25% capacity. So that's additional stress. So your endocannabinoids, or the cannabis that's produced in your body, those levels are going to be lower and lower, causing uh, that deficiency. And one of my mentors, Professor and Dr. Ethan Rousseau, he published an article on the uh, clinical endocannabinoid deficiency. What occurs when you are deficient, when those levels in your body go down? And we have discovered that the 3 most common conditions or diseases that are linked to this endocannabinoid deficiency are fibromyalgia, migraine headaches, and irritable bowel syndrome. But then they've also linked it to post-traumatic stress disorder, bipolar disorder, failure to thrive in children, as well as a host of others. So when the levels are low, you need to replenish it, and that's why you need the exogenous or cannabis from the outside, exo meaning outside. So cannabis from the outside to be used within the body to be able to get these levels and stimulate and work on these receptors.
So you're talking about stress, and a lot of people, when they think of stress, they think of stress hormone, they think of cortisol, they think of adrenal function. Is there any correlation between the endocannabinoid system and like cortisol?
Yes, because when you're under stress, those stress hormones kick in, and then you enter in what's called fight or flight. You either stay and fight, or you have the energy to run, flight. So you've got that combination. Therefore, when you have that going on, you've got these action potentials, which are nerve stimulations going down neurons, and neurons meet. You've got a presynaptic and a postsynaptic. Pre meaning before, post after, and then the synapse is where they communicate, where they connect. Right at that juncture is where you get that potential coming down, causing neurotransmitters or nerve proteins that cause channels to open up. And you have sodium channels opening up, calcium channels opening up. They cross the synapse, and then that's what causes the formation of the endocannabinoids, anandamide and 2-AG. They move what's called retrograde or backwards. So they're formed in the postsynaptic, but go backward to the pre, where the receptors are found. And once they go into that presynaptic groove, it's like a lock and a key. The keys are formed in the postsynaptic, and the locks are found in the pre, so that those endocannabinoids go backward, go into those locks, and the key goes in there and click, it opens them up, and that's where you get that feeling of blissfulness.
Wow. Okay, I got a really random question. So I've always heard that you can find there's CBD is in breast milk.
Yeah.
Okay. So is there any correlation to, because I think we're all deficient on CBD. There's whether
it's not CBD. It's not CBD. It's anandamide.
Okay.
Okay.
Thank you
So
for correcting me.
the endocannabinoids that are formed in your body are transferred through the breast milk. Now, CBD is a phytocannabinoid. Phyto meaning plant, cannabinoid meaning structure of cannabis or cannabis-like. So in the plant, you have there are 144 phytocannabinoids that have been in some way, shape, or form identified. The ones that get the greatest amount of publicity or media coverage are CBD and THC. And media will crap all over THC because that's going to get you high. And they raise and the heavenly angels come down from heaven, and the dove lands on the head of CBD and says CBD is medicine but THC is bad. It's like, no, they're both good because they have to work together. Just like when we discussed that the other day with Dr. David and Dr. David,
Yeah.
the double Davids. It's an entourage effect or an ensemble effect. They work together. It's like when you go to the orchestra, the symphony, and you're hearing all of the pieces of the music working together to make a beautiful piece. I'm a big Top Chef fan, and last week they had the conductor, the Venezuelan conductor who was the youngest conductor. He's the conductor of the Los Angeles Philharmonic.
Oh, nice.
Yeah, he's amazing. But the task that he gave the chefs was they had to use contrasting flavors, sweet, sour, sweet, umami, whatever, and create a harmonious dish. And he's talking about how every part of the orchestra has its own taste, its own color. And so it's the same thing with cannabinoids from the plant. Each one has its strengths, it has its weaknesses, but together with the cannabinoids of CBD, THC, CBN, CBG, THCV, etc., you also have what gives the plant the smell and the taste, which are called terpenes. So now you're adding limonene, which is also found in citrus. So it gives that citrusy flavor, or pinene, which gives it that pine flavor or smell, or beta caryophyllene, which is found in black pepper. But each one of them also have a healing property. So now you're combining the terpene with the phytocannabinoids in harmony together to work on the different receptors in the body to work in a symphonic way to heal.
So we really need the whole plant. So in this case, when you have children that, parents are, there's all of these network marketing companies now that have CBD, and they sell CBD at 7-Eleven and the and the poor neighbor. I don't know what to call those.
I just
types
got
of
throw
grocery
up
stores.
in the back of my throat.
Yeah,
Okay.
I am too. So there's but you have these parents that are like, well, gee, if I can buy it through network marketing, it's safe for kids. What is your feeling as a medical professional, as a physician? What is your feeling about children using CBD isolated or the whole plant that has the THC, CBN, and everything else?
Well, I'm an advocate of using the whole plant because that's how it was created to be used. And
I agree.
so let's use the whole plant and get the benefit of everything that's in that plant. And the way these growers have, you know, improved on their trade, these guys are masters. They truly are masters where they are able to, with not using GMO, but just through natural ways, being able to mix and match and combine to be able to get the best expression of the different phytocannabinoids is remarkable. I mean, that's a true science and a true art, and they're just absolutely, I'm in awe of those guys because
What's
they're
too early of
phenomenal.
an age for children or people to use?
Well, I mean, I got an 18-year-old asked me that today. I went, I was out running errands with my mask on, and I had, my scrub top, and it's got, a cannabis leaf on one corner and my name, and she's like, "You do medical marijuana, right?" I'm like, "Well, I recommend it and I use it, but I don't do it," and and so she's like, "Well, how old do you have to be?" And I said, "Well, how old are you?" Because I mean, she looked like a little girl, and she's like, "No, I'm 18." I'm like, "Oh yeah, you're of age." I said, "But my youngest patient to date has been 18 months old, but that 18-month-old child had cancer,
Yeah, wow.
and so um, she was, the parents and the child were in the hospital. They heard in the ward parents speak one with the other,
Mhm.
and a group of parents on the ward were patients of mine. Their children were patients of mine, and so they told his mother, go see Dr. Rosado for your daughter. So she was my youngest, 18 months old. So there's no age limit because if as long as you have a spinal cord, you have an endocannabinoid system. So dogs, cats, horses, all vertebrates have an endocannabinoid system.
So there's it's the news, it's so hard to know. Like you see something published all the time, and when you're reading the news on your phone or in the newspaper, there's something new that always contradicts the last new thing that came out about cannabis.
Well, as your president would say, fake news.
Yeah. It's confusing. So there's a lot of
It
people
is.
that are being
It's
misled.
very confusing.
Is cannabis for a child that young, 18 months, 5 years old, 6 years old, 12 years old, 13 years old? The rumor is that cannabis would stunt your brain development. Is that true?
Not that it would stunt it, but it would predispose the child to develop schizophrenia in their early adulthood. So, schizophrenia typically shows up in the early 20s, usually when you're in college, is when typically people develop. What?
I'm
Why are you rolling your
laughing
eyes,
because
raising your eyebrows?
no, I'm laughing because I was diagnosed as schizophrenic in college. But to be honest with you, it had a lot to do with acid, cocaine, and ecstasy, and everything else that I was doing. So, I mean, I think that probably had more to do with it. That's why I was
But
laughing.
yeah, but you're in your early 20s. You go in, you say, I'm hallucinating, I'm seeing visions, I'm hearing voices. Oh, well, schizophrenia. Yeah, let's put that label on you, rather than saying, so, what are you doing when you're not in class or while
Oh,
you're in class?
no, they didn't ask that. They were just quick to write all the meds.
Exactly.
And God, that
So
medication made me crazy.
so that's what's been discussed. However, the pioneers in this, Rafael Meshulam in Israel, Professor Lemir Hanoush, I've heard them speak. I heard Professor Hanoush speak last November in Colombia, and he they're doing a lot of work on two populations right now. That's what he presented was his latest research. And his two areas of research right now are children with autism and women with endometriosis. Those are his two areas that he's focusing on right now.
Wow.
And he brought this topic up on how it's been perceived, and this one specific study spoke of, how children can have a predisposition to becoming schizophrenic in their early adulthood. And when he got off stage, I mean, he refuted it and he had the science to demonstrate it. But when he got off stage, I was getting ready to go on stage, and I pulled him off to the side, and like in a quick 30-second, conversation, I'm like, hey, I've got this study that has followed individuals from adolescence all the way into their 30s and monitored their brain structure and their brain formation, and it demonstrated that, and that long-term study, there were there was no atrophy found in the brain. There was no sign or indication of schizophrenia. And he said that what they failed to explain in that original study was that the people that developed it had a predisposition for being schizophrenics. There was a family history of schizophrenia, and that's why it was a poorly done study.
Ah, okay.
And so, but there are other studies that have shown that when people have been followed for years, there have been no challenges, no issues with the brain. And there are quite a few pediatric patients that we manage in our office, children with a condition called Dravet syndrome, which is a condition that children suffer with seizures anywhere between 20 to 200 a day.
What?
They're in constant seizure mode, seizure activity. And the young lady that one of the chemobars or strains that most people are familiar with, Charlotte's Web,
Mhm.
Charlotte Fiji, that was the condition that she had. She had Dravet's, and her parents then got her started on the medical cannabis, and it helped her tremendously.
Wow. So a lot of people talk about, you can search the internet for Rick Simpson oil and you can watch all the videos, and there's all of these claims that it's killing cancer, and documented claims rather. What is your feeling about the cannabis's ability to fight cancer?
Well, there is research done, not in the United States yet, because cannabis remains a Schedule One drug in the U.S.
We got
And
to check.
because it's a Schedule One drug means it's federally illegal. Uh, Medical schools cannot study or research cannabis proper on humans, because if they receive federal grants, then their federal grants will be pulled because they're engaging in studies of a federally illegal drug.
Okay.
However, studies have been done abroad. Studies have been done for the most part in Israel, and that's where the bulk of the studies have been done. And the studies have shown that cannabis does cause apoptosis, which is the killing or the drying off or the shrinking of the cancer cells, as well as shrinking cancer tumors. And there's but back in right when things were getting ready to start in the state of Florida, I did a presentation on the use of medical cannabis to a group of hematologists, oncologists, cancer specialists. And I showed the before, during, and after slides of a child's brain MRI who had brain cancer. And the father was putting cannabis oil on the child's pacifier.
Huh.
And in a time span of, I believe, 6 months, don't hold me to this, I believe it was within 6 months, the tumor all but disappeared.
Wow.
So there are and there are more than anecdotal findings. There are some legitimate findings out there that have shown this. Now, just like my mentors before me have said, I will repeat what they say. Cannabis is not for everyone. Cannabis
Correct.
doesn't work on everyone. But guess what? Neither does aspirin.
That's true.
You know,
What?
so
Okay.
so don't bitch. You know, it doesn't heal everything. Well, neither does chemotherapy. You know, we do the best that we can with what we have. So the use of cannabis in my practice is one more tool, which leads me back to the original question: how did I get involved? When I was in medical school and I learned about it, I realized that it was one more tool in my toolbox for me to utilize for my patients.
Yeah, but you went all in. I mean, where was the shift where you after medical school where you dedicated your career to this?
Do you remember that song by Billy Joel? I don't know why I go to extremes.
No. I barely know any Billy Joel songs. I'm kind of embarrassed to say.
Well, he had a song, and that was a line in one of his songs. I don't know why I go to extremes, because that's me. If I'm passionate about something and I'm really, I've researched it and I've read it and I see the beauty and the benefit behind it, then, like you said, I go all in, and I did. I saw the benefit. I saw how much better my patients were, how um, how little side effects they were experiencing, you know, how much better they were doing with their families, with their friends, with their children, etc. And to be able to take people that were taking 42 to 58 pills a day and drop them down to, you know, 1 to 2 pills a day, and now they're able to be, productive in their work environment, productive in their household, productive in their community, that makes a huge difference.
So a lot of the audience comes from, their whether they have a loved one that's, heavily addicted, they're they're addicts themselves. Talk a little bit about how cannabis can be used to fight against your, heroin, opiate, methamphetamine, cocaine, those types of addictions. How is cannabis being used as an aid, or I don't really know the appropriate term, but I do know a lot of people in a lot of rehab facilities are starting to open their eyes to using cannabis as an alternative to help treat people and get them off of these hardcore drugs.
What they have found is that um, the receptors that cannabis works on are different than the receptors that opiates work on, and so
Huh.
when when you're weaning a patient off of an opiate, the biggest uh, issue that they have is craving. They crave that drug. And so how are those cravings usually treated? They give them a benzodiazepine. They give them Ativan or lorazepam. Well, Ativan, lorazepam, same thing. Alprazolam, Xanax, diazepam, Valium. They give them a benzodiazepine to offset the craving and to address their anxiety. Okay,
Mhm.
cannabis works in the same way because CBD, for example, works on the GABA receptor, which is the same receptor that uh, the benzodiazepines work. So it works on the anxiety. It also, the THC component, works on the brain part, so it allows for that anxiety and depression, the anxiety and the cravings to be reduced. Therefore, you're able to wean them better. Also, by incorporating cannabis, it lowers the the threshold of opiate by 4 times. So they don't need as much of an opiate to get the same effect or same result. That's why when patients come to our office and we're weaning them off of the opiates, for the first month, we leave them on the same opiate dose, and then we just add the cannabis to that. By adding the cannabis to the opiate, now they're realizing that they don't need as much of the opiate to have the same effect that they were having before,
Wow.
because cannabis works on pain. It's an amazing pain reliever. It's an amazing anti-anxiety medication. It's an amazing uh, antidepressant. It's a great mood stabilizer. So we combine the two, and by combining the two, now they're able to get off of the opiate. And as they go down on the opiates, we go up on the cannabinoids, on the cannabis.
Mhm.
And then we pick and choose. We start with one medication, then another one, and little by little, we don't take all of them away from them. It's a phasing. It's a phase 1, 2, 3. So we start with the ones that are easiest to get off of. So like your short-acting opiates, like oxycodone with acetaminophen, Percocet,
Mhm.
or hydrocodone and acetaminophen, Vicodin, Lortab. We start with those because those are short acting and those are quick to get off of, because we replace those with a vaporizer pen. So when they have breakthrough pain, instead of taking the short acting opiate, we hit them with a short acting vape, because the vape takes 3 to 5 minutes to start working, but it lasts 2 to 4 hours. Whereas the oils or the tinctures or the edibles, those take about an hour and a half to 2 hours to start working, but they last anywhere between 6 and 12 hours, depending on how a person metabolizes. So for that reason, we combine the oils, tinctures, or edibles with the vaporizers, whether they want to vaporize the concentrate, vaporize the flower, or actually combust, smoke the flower, and then we use that, and then slowly take them off of the opiates, and then we start taking them off of the other stuff.
So my friend Patrick here is battling MS, and when I worked with complex disabilities for 18 years before I got into doing what I'm doing now, I worked with a lot of MS patients, and here in Oklahoma, cannabis wasn't legal in any respect back then, but there was a lot of rumors going around about how cannabis was helping patients that were suffering and battling with multiple sclerosis.
Mm-hmm.
Can you talk about that a little bit, and how
Sure.
cannabis benefits that?
Absolutely. The way cannabis helps is because it works on the muscle spasms. It,
Oh,
it relaxes the muscles. It works as a muscle. It relaxes muscle spasms, and by relaxing the muscle spasms, it alleviates their pain. One of the biggest issues with multiple sclerosis is that it's a condition that waxes and wanes. They have a period of where they're fine, and then they have a remission, and then they go back. But every time they have a remission, they get worse than
yeah.
they were before, and it's a chronically debilitating condition where they end up, with walking with a cane, then crutches, then a walker, and eventually in a wheelchair. And so by using the cannabis, it helps with their pain because it's multiple fold. It works. Cannabis has also been shown to be a neuroprotective device, medicine. It protects the nervous system.
Wow.
And the problem with MS, for those that don't know, imagine my finger is a um, is a nerve okay, and that nerve is covered by this sheet of paper, okay. That's called a myelin sheath. That's covers, and it's made of a fat, okay. So it covers the nerve. What happens with multiple sclerosis is it's a demyelinating condition. It removes the myelin, and by removing the myelin, it leaves this nerve raw, exposed. And that's where it's constantly firing and bombarding. And so by using the cannabis, it helps to relax and calm that nerve from being in that constant firing state.
That's so freaking cool. What an amazing plant. I didn't know all that. Like,
So it's a neuroprotective. So right now we're looking at the future of medicine is incorporating this in these debilitating and deteriorating nerve diseases like Alzheimer's disease, Parkinson's disease, multiple sclerosis, Huntington's chorea. These are all diseases that affect the nervous system, and you can block and stop the progression of a lot of these conditions. I've had patients for about 2-3 years now that had MS that came into the office in a wheelchair, and the last time, and emaciated because they were so thin they couldn't eat, they were just in terrible shape, and they're now walking in, and they're walking in on their own accord with no canes and nothing, just amazing. Which
That's
explains the muscle spasticity. Exactly.
wow. All right. So now I want to segue. I have a list of things because I've been personally affected by a lot or have relationships with people that have dealt with various conditions like MS and ALS and muscular dystrophy and cerebral palsy.
Hmm.
And then, of course, addiction, but also HIV. That is, cannabis is also a lot of in the HIV community, cannabis is very prevalent as a way they talk about it helping with side effects and things like that. Talk about how cannabis can benefit patients that are suffering with HIV.
Well, a lot of the HIV medications cause neuropathy, cause nerve pain because they are neurotoxic. They attack the nervous system. Same thing with chemotherapy. Chemotherapy, most chemotherapy, most chemotherapeutic agents are neurotoxic. They attack or affect the nervous system, and it causes this severe nerve pain, which is why in the HIV community it is so um, freely used and accepted because they've realized and they've noticed that it does support a lot of their nerve pain for the reasons that I just explained regarding the multiple sclerosis. It works, it protects the nervous system, and so therefore it alleviates a lot of the pain that they are experiencing. And because you can use it in so many ways, you can use it topically, use
Mhm.
the oils instead of putting the oils under your tongue. You can apply the oils directly on your feet, which is the main place where the neuropathy attacks. It attacks the peripheral areas. So, um, what about neuropathy?
Yeah.
That's what.
Yeah. You just answered his question. That's perfect.
Yeah, the nerve pain is neuropathy, and so it primarily affects the hands and the feet. But also diabetics suffer with neuropathy. There's diabetic neuropathy. So in the HIV community, it's neuropathy caused by medications. In cancer patients, it's neuropathy caused by chemotherapy. In diabetics, it's diabetic neuropathy caused by either being a brittle diabetic or not managing their diabetes properly.
That is, and then Carla asked about fibromyalgia and osteoarthritis. That's the answer. I think you talked about that earlier, correct?
No, I haven't mentioned that, but
Oh,
osteoarthritis is just your typical run-of-the-mill arthritis. Anything that ends in itis means inflammation. So osteo means bone, arthro is joint, itis. So inflammation of the joints. That's what osteoarthritis is.
wow.
And CBD specifically, well, CBD, THC, they are all anti-inflammatories. What you and I discussed a few weeks ago was that phytocannabinoids, they have found that CBD, THC are 20 times more powerful than aspirin as an anti-inflammatory and twice as powerful as hydrocortisone, which is a steroid for inflammation. CBG, another phytocannabinoid, is 5 times more powerful than CBD as an anti-inflammatory. So that's how that works. And when you have inflammation, that is the main cause of a lot of illnesses in the body. Any type of inflammation, you want to keep the inflammation down. With fibromyalgia, not only do you get inflammation, but you get a lot of what are called free radical formation. And the phytocannabinoids work that the phytocannabinoids work in fibromyalgia patients as an antioxidant. And by being an antioxidant, it's like a Pac-Man gobbling up those free radicals, which cause the pain and discomfort.
That's so dope. I mean, there's just I'm blown away by this because I thought, I mean, obviously you're a physician, of course you're going to know more than I do, but I've really spent a lot of time trying to understand this plant. So because I'm an advocate for it. And one of the things that I warn against with a lot of different people is the drug interactions.
Mm-hmm.
And if somebody's on medications, like a heart medication, they're on pain medication, and they're just not really, it's affecting them in a way that they don't really like. And they're looking to go, okay, cannabis, you came from the earth. I think it's about time to try. How do you recommend somebody who has never used cannabis, or at least from a medical side, not to get high in high school at the drive-in or whatever they do, but they're
Drive-in,
now
you are showing your age.
I know. But somebody that's really looking for an alternative and they want to try cannabis for the first time, what do you recommend that they do?
The first thing we do, and the way I've trained my doctors, is first and foremost to find out what they do, what they're comfortable with, what their experience is. For example, my mother's 80 years old. She's never smoked a day in her life, not even a cigarette. So she doesn't know how to inhale. Contrary to Bill Clinton, who said he didn't inhale, but she doesn't know how to inhale. She inhales because her body is in control and inhales and exhales for her.
Right.
But to put something in her hand for her to inhale, she has no clue. So I would never tell my mother, okay, you need to, vape or this, because it'd be a waste of time and money. So if I have a patient like that in front of me, then I'm going to go with a different route. And as far as inhalation goes, there are some products that are available in a nasal spray. So you can use a nasal spray, which will get into the system in the form of an inhalation because it'll make its way the way it needs to. So the first thing is find out how experienced they are, find out what they know about the product, first and foremost. Then we always have a list of what medications they're on, and we educate them on the possibility and the potential of a drug-drug interaction. A few months ago, prior to this whole coronavirus, the last speaking engagement I was involved in, I spoke on cardiovascular medical cannabis for cardiovascular diseases and showed how cannabis has been studied to lower blood pressure, and it does lower your blood pressure. So if you're for example, the typical blood pressure patient is on 2 to 3 blood pressure medications. They are on a diuretic, a water pill to make them pee. They're on either an ACE inhibitor, something ends in frill, blood pressure medication. Then, if that doesn't work, then they put them on a calcium channel blocker, amlodipine or Norvasc, which is trade name, generic name. So now they're already on 4 different types of blood pressure medications. We add cannabis to the mix. Now they can bottom out and drop their blood pressure so much that they become dizzy, they get faint, they pass out. So that's where we have to be careful and say, okay, these medications are all metabolized in the liver. Cannabis, when taken orally, is also metabolized in the liver, and they're metabolized using the same enzyme, which is a cytochrome P450. They're all metabolized by the same enzyme. So now you need to be cautious not to take them simultaneously because they cannot work correctly because the liver is lazy and it goes through the path of least resistance. And so it's going to metabolize the easy shit and it's going to push to the side the hard stuff. And so now it is when you get into real medicine. So to have a medical cannabis practice, it's not a matter of here, have some weed, smoke it, and I'll see you in a year.
Well, that's kind of what I did to my doctor. I haven't been there in 2 years.
I'm gonna choke you. I swear to God.
I listen. I don't know what it is. Like I've worked with physicians most of my life, and I don't go. So I'm a I'm a well, I self medicate. I just don't self medicate
Well,
the
you're
way I used
also a
to.
man.
Now it's something else.
Let's be honest. You're a man, and a man goes to the doctor for 3 reasons and 3 reasons only. Number one, their wife made them go, or their significant other, their wife, their husband, or their significant other says, you got to go because I'm concerned about your health. That's
Mhm.
one. Number two, they are afraid that they're going to die, like I did when I was having chest pains and I was having angina, and I thought I was having a heart attack. And that's when I thought, okay, I think I'm going to die. So
Oh,
I
gee.
decided to go to the emergency room. Okay. Or the time I had a blood clot, and after a week, I decided to go because I threw up and my lips were blue. Otherwise, I wouldn't have gone to the emergency room. Okay. And I was already a practicing physician. And the third reason why a man goes to the doctor's office, you want to guess? The third reason?
Prostate,
No, you're close.
Viagra,
Because the little head doesn't work.
right? Viagra.
But
Oh,
those
there you
three
go.
reasons. That's it. Other than that, men don't go to the doctor.
That's that's true. I do need to go to the doctor though. Okay. So we've got a couple more minutes before they cut us off on the TV network, but I want to ask you because right now there's this belief that you can throw CBD or cannabis in anything, it's going to enhance it. So it doesn't matter if it's a pre-workout or it's a vitamin, or a dog treat. But one of the things that's an industry that's starting to really boom is cannabis and skincare. What
Mhm.
is your feeling about that?
Well, there are CB1 receptors. There are cannabinoid receptors on the skin, and so there is absorption. And I have managed quite a few patients with different types of skin cancers, squamous cell carcinoma, basal cell carcinoma, multiple myeloma, before it's gotten, you know, too aggressive, and they've applied it topically onto the actual lesions, and they have had some very, very positive results. Also for acne, because
Oh,
cannabis has it's a antibiotic. It's an antibacterial. It fights bacteria. Specifically, studies have been done with CBD and CBG, and both of which have been shown to be antibacterial. CBG has been shown to be beneficial in MRSA, methicillin-resistant Staph aureus, which is a very aggressive bacteria. So in that case, melanoma, yes. Um, any type of skin lesion, skin cancer, the topical oils have worked very, very well. We've seen some very, very positive results.
that my father died from stage 4 metastatic brain cancer, melanoma that had got
Mhm.
into his brain, his lymph nodes. And my father was a very proud, strong-willed man, and melanoma reduced him to a guy that was shuffling his feet, couldn't talk, and having full brain radiation for 30 something days straight. He did not use cannabis, or he would not use it. He wouldn't use it as pain relief. He wouldn't use it as a topical. He wouldn't use it for anything. And so hearing you say that is, I hope anyone out there that knows somebody that has melanoma and is dealing with that, I hope you just heard what the doctor said.
Yeah,
Because
I
it's
mean,
better than not trying
one of
it.
my bosses, yeah, one of my first bosses told me, convince a man against his will, he's of the same opinion still. And it didn't matter what you told your dad. In his mind, cannabis was the devil's weed, and he wasn't going to touch it. And it's sad, and it breaks all of our hearts that are into the movement and are seeing the miracles. But it's an unfortunate thing.
I mean, and in fairness too, I mean, as he was dying, like he wouldn't use cannabis, but he would drink 5 bottles of wine. So,
because that's
I
legal.
don't know if he thought it was Jesus juice or what. I have no idea.
Hey, it's illegal. And Christ did turn water into wine. So hey,
Yeah, well, it didn't help. Hold on. Patrick has another good question. So because there's a lot of states that haven't legalized, and there's not a reputable supply. Hey, dude, call me. I know somebody. What's I know somebody that caters to cancer patients, MS patients, and he doesn't care if he goes to jail. Like, he's going to bootleg it into wherever you need it. But he's asking, like, what do you do? Like, if you don't have access to this, what do you recommend? And I know this is a dangerous question for a physician.
it is. And
You want me to answer it instead?
there are no. I mean, there are some reputable. I'll give a generic answer. There are some reputable companies out there, and the best way to find one is to request or look for what are called certificates of analysis, or COAs.
Mm-hmm.
The certificate of analysis is a third-party individual, an independent lab that has run a study on that product. So if you go to a website of anyone that's pushing or promoting CBD, which is legal in all 50 states and U.S. territories because of the 2018 Farm Bill, and that can be transported through planes, trains, automobiles, no problems. Look for their certificates of analysis. And if you don't see a certificate of analysis in their website, in the section where it reads contact us, ask them, hey, where's your certificate of analysis? Show me where this is coming from and demonstrate to me that it doesn't have mercury, lead, pesticides, because prior to the Farm Bill in the United States, individuals were bringing in hemp from China and the Ukraine, which have questionable growing practices and use pesticides that have heavy metals and use fertilizers also with heavy metals. And hemp extracts a lot of crap and junk from the ground, which is what was used in Chernobyl to clean the ground. They planted hemp to clean up the nuclear waste that was in the ground. So
it
ask for a
reestablishes the
certificate of
soil and
analysis.
everything too, right?
Right. So you ask for a certificate of analysis. If you have any questions, just email me. My email address is info@josephrosadomd.com. info@josephrosadomd.com. Shoot me an email. I'm very easy to reach. I'm all over social media. I'm on Facebook. I'm on Instagram. My Instagram is Dr. Joseph Rosado, Dr. Joseph Rosado. On Facebook, Dr. Rosado IMC. You can also go to Amazon and pick up my book. Let me get on the camera. There you go. Hope and Healing: The Case for Cannabis. And you see all the different conditions that we addressed today. And there's
it's
my
in
name.
Spanish too.
Hang on. See, you blew my thunder, man.